So I think this is a challenging question because I think there's always a lot that we could research, and there are lots of areas where we could potentially make improvements. I do think in the current phase 2 landscape, the applications being investigated are quite broad. Many of the novel agents that can be used to treat solid tumors with poor outcomes specifically are actively being investigated. So there are a number of clinical trials in that space. I think there's broad room for identifying novel radiotracers that provide better phenotyping for solid tumors and even potentially hematologic malignancies that are currently difficult to image. And examples of this include mucinous producing tumors of the GI tract or multiple myeloma. And multiple efforts are focused on treating cancers like pancreatic cancer that simply have relatively few effective treatment options. And they are also not imaged well by any current tracers. So I think we will see that with the current phase 2 landscape, I'm hopeful that there will be some effective drugs that come out of that as a result for these cancers that are more difficult to treat. And as I mentioned, another area where I think we do have much to explore and develop is in how we treat hematologic malignancies. So there have been a few promising radiopharmaceutical treatments for lymphoma and leukemia, but unfortunately, funding limitations have prevented at least one of these drugs from being approved for clinical use. And it is unclear whether continued funding limitations will prevent expansion in that space. But I do think there are big opportunities there as well, across all of the heme malignancies to potentially use radiopharmaceutical therapies to treat those as well. Finally, I think we will always have gaps in what we understand given our limited resources, and particularly now with limited research funding. And with that limitation in the resources, we won't be able to identify all of the mechanisms or the effective drug entities that show the greatest promise for treating cancers. But my hope is that as investment continues and as we continue to try to focus our efforts on radiopharmaceutical development, we'll be able to continue making progress in developing effective drugs. In terms of hurdles generally, as I mentioned in my last answer, we are limited by funding and resources in terms of what we can develop and get across that approval finish line, if you will. We are, of course, inherently limited by the process of clinical trial development, which affects all drugs being developed. That said, uniquely to radiopharmaceuticals, the requirement to obtain dosimetry is unique to nuclear medicine, and I think that's well incorporated in phase 1 at this point. Whether that gets incorporated into phase 2 and phase 3 to continue optimizing dosing is an open question, and that does remain a challenge for our field. How can we use dosimetry to determine the best dosing strategy to achieve the best outcome for each individual patient? Additionally, there are questions that remain regarding what the best approach for calculating dosimetry is with radiopharmaceuticals, as well as what is the accuracy and clinical meaningfulness of dosimetry. That said, we have a lot of different groups who are actively involved in trying to develop those methods and those quantitative approaches for dosimetry. As we can see when we look at different imaging studies, different patients have different distribution of drug. And so if the drug distribution varies by patient, from a common sense perspective, it seems to make sense that you would want to take advantage of that information to best determine the dose of and how to deliver it so that you can most effectively treat the cancer that that patient has without causing undue side effects from that. As we look at how we personalize those dosing strategies, I think that will be one of the biggest areas where we'll want to transition in our practice to becoming smarter and better in how we dose our radiopharmaceuticals. Other logistical hurdles include the distribution of radiopharmaceuticals in general. So as I mentioned, a number of different clinical trials are looking at alpha emitters. There are a broad spectrum of alpha emitters, some of which have shorter half-lives, some of which have longer half-lives. Depending on the distribution network, there may be gaps across the US where we can't deliver those radiopharmaceuticals, and that would require patients to travel long distances to centers where they can get access to those radiopharmaceuticals. So I think the distribution network of radiopharmaceuticals is a logistical challenge as well that we need to think about. We've we have experience with that already with gallium-68. Gallium-68 is a PET imaging isotope with a very short half-life, 68 minutes. And so that does have a limitation in terms of how far you can get the radiopharmaceutical from a distribution center. And companies are working hard to close the gaps in terms of availability of gallium-68 across the country. So I anticipate that companies will also continue to address the distribution network challenges for therapy radiopharmaceuticals, but that will take a lot of investment, and that potentially will take, partnering with the government, in addition to private investment to make that happen. Yes. So besides dosimetry, I think we have a lot to learn about all the patient-specific factors that can help us identify patients who will best respond to radiopharmaceutical treatments. Molecular imaging can provide a lot of information about the heterogeneity of disease and potentially provide different phenotype information if we use several different molecular imaging scans to look at what the tumor expression profiles are. Additionally, multiple new assays are being developed, including cell-free DNA and tumor DNA tests, to better characterize how different cancers behave within different patients, including how they respond to different treatments. So, defining how we can incorporate genetics or these other tissue-based assays with molecular imaging is a huge area of opportunity to better understand differences in tumor biology and can potentially give us a way forward in how we can truly personalize treatment approaches to improve outcomes for patients with cancer.